So, Martin, I've been looking forward to this conversation for a couple of weeks now. I know you are and your team out in Pennsylvania are absolutely crushing it and helping a ton of patients. So, I'm excited to dive into that today and learn a little bit more about what's working well for you, some patient stories, things that people really want to hear and that they care about. So, welcome. Appreciate you taking some time to jump on with me.
Yeah, of course. It's always cool to, kind of go down a different, path. First time I've ever done a podcast before, so it's kind of, you know, not anxious, but I'm excited to kind of get it out there and talk about what we've seen in Pennsylvania. So thanks for having me on.
Yeah, absolutely. So, the question I have for you is really, if you were to try and describe the mission that you're on right now as it pertains to what you do at work, I guess what would you say that is?
We want to stop chronic wounds where they're at, so like our mission here in Pennsylvania is to fix a broken system, truly. We've been hearing a lot across the landscape here in central Pennsylvania all the way to the Pittsburgh region that the wound care system, it's broke. These patients, they don't have the overwhelming positivity, when they first were going to those clinics. They don't see an end in sight. And for us, our mission's really simple. We want to give you that hope back, and really put an end to that wound journey that you've been on.
Why do you think the system is broken? Maybe a loaded question.
That is kind of a loaded question. We could probably sit in here and talk for a couple hours on why I feel the system is broken, but I don't know. I think honestly, it's probably twofold. It's probably non-compliance, and it's probably a factor of just logistics. A lot of these wound centers are in like major cities. You have a lot of Pennsylvania is kind of we're wedged in between like four major cities here in Pennsylvania. We got Pittsburgh, Philadelphia, Harrisburg, and Erie, and then you have a very rural system where you know access to good healthcare is it's difficult to get to.
Yeah, I'd agree with that. And we see a lot of the same in Virginia, where a lot of our rural areas, there just isn't the same resources that people might have in larger cities. And even where I am in North Virginia, what's interesting is that there's still a major need because the thought of patients leaving their house to drive 10 miles to sit in their car for an hour because they're in Northern Virginia traffic, the logistics just don't make sense either. And for the average person who's already getting home health, technically they're homebound. So these trips out to go to a wound clinic, like, well, if they're going to make a trip out, at least make it somewhere where they want to go, not where they want to go and get like debrided and cut and it's just not a very pleasant experience. So we see a lot of the same too. I hear a lot of passion, I think might be the word, coming just from the way that you're communicating. I can tell that this means a lot to you personally. But I'm curious, like, what's behind that? Why is this actually so important to you?
Well, in the forefront of what I've always done for the patient, first and foremost, I'm a social worker, so I believe that that type of accessible healthcare should be readily available to every person. Not even just the person that has Medicare Part A or a really good Medicare Advantage plan, but it should be accessible to everybody. Even those low income individuals that they're a part of the system too. I think the Medicaid system, a lot of those individuals feel that overwhelmingly hopelessness in their health. So I think at the end of the day, it's just really putting, looking at it through the lens of the patient, and really just saying, hey, we have a solution for you. Um, but I do appreciate the overwhelmingly positive conversations that we have on a daily basis. It's the reason why, I roll out of bed in the morning, because the more people that have access and information to these resources, the better those patients' outcomes are going to be.
Yeah, and on patient outcomes, because that's why we're here. I mean, at the heart of it, what is it that we do at Rebirth? And it's we heal wounds, heal chronic wounds, and help often fragile senior population. But I know that you and your team there in Pennsylvania have some tremendous success stories. Are there any ones that are like really fresh in your mind that you can share? Because I think this is really important. If like for example, healthcare practitioners, professionals that might be listening to this, or maybe folks who have chronic wounds, or maybe their family member has a chronic wound and they just stumble upon this conversation. I think what they want to hear is, well, what is the story, or what are the stories of some of these folks that are maybe going through the same thing I'm going through, my family member is going through, or some of my patients might be going through. So could you share some of those success stories?
Yeah, actually, so last week, the Pennsylvania team, my salesperson Rachel, myself, and our practitioner Sean, we went out and celebrated two individuals that we healed. You know, they hit their 10 weeks of treatment. These were both individuals who are in a personal care and assisted living facility, and they lost that level of hope as they were going through, you know, their wound journey. You could hear it from the one person's spouse who resides with her in this assisted living facility, and he can come and go as he pleases. You know, she can't. She's kind of, you know, not restrained, but she's kind of just, you know, a part of that, doesn't want to come out of her room. She's in a lot of pain. You know, we ended up receiving a donation of a quilt. And one of the things about myself is I'm really observant when I go in. You give me the opportunity to meet you as a patient, I'm going to scope out your room. I'm going to scope out your living quarters because I want to know what motivates you. What do you like? So I noticed that she had, you know, some country quilts on her wall. She wrapped herself up in the quilt the first time I had met her. So it was kind of cool. My mom retired as a nurse a few years ago, and she's been quilting, you know, on the side. So I was talking to her about our patient, and I was like, "Mom, I need something that is going to have this woman and her husband never forget who we are and what we've done for them." So we go up to the attic and we're looking through all these quilts, and I came across the quilt. And this quilt has, it's purple, it's white, it has forget me nots on it. And I was like, that's it. That's the one I want, because the message is clear. Don't forget us after we leave. You know, we helped you through your wound journey. Forget me nots in long term care are actually a really big deal. Um, you know, as patients are going through with Alzheimer's disease, you know, so we thought the message behind the quilt, it was just a small little token of our appreciation in helping this woman through her journey with these chronic wounds. So when we presented it to her, you just saw like this, she was so taken aback, you know, that we gave her something in addition to healing her wound. You know, she's like, you didn't have to do this. I said, I know. We want to. Not only do we want to thank you for taking an opportunity to try our service, we want you to have something to remember us by. You know, so it was kind of one of those moments that it was really beautiful. And but this individual, she was dealing with venous ulcers on her right leg. Um, in and out of the wound center. She was on home health. You know, she was going through the motions, going to the wound clinic every other week, like you had mentioned, debrided.
How long
She
was
was,
she going to the wound clinic for before we all got in there?
I want to say it was about 6, 7 months.
Wow.
Um, she was on with home health, and the home health agency felt that the facility understood how to do the wound care. So then they no longer had a skillable need for that individual because they were only taking care of her wound.
Right.
Um, you know, so here we came along very, very early on in our, you know, launch here in the beginning of April. And by the end of April, she was on our census as our first patient being grafted. So it was kind of cool. You know, she was our first one going down this opportunity with us. And, you know, when you meet these individuals, you see, how they're taking to, certain treatments. You start to build that relationship with them. The first time before our treatment even began with our practitioner, you could see that she was a little scared about debridement, and what
Right.
that might feel like. And you could just see that she was a little anxious. And I said, listen, Sean, our provider, is going to use the utmost kid glove situation with you. We're going to make sure that you do not feel any type of pain or discomfort in that debridement, prior to your first, application. And she's like, do you promise? And she's holding my hands. And I said, I promise, like you're my own grandmother. He is going to use kid gloves with you. And she's like, that's really nice to hear, because when they pull that scalpel out at the wound clinic, I freak out. And I'm like, don't freak out. We want to
I think
help.
I would too.
Yeah, absolutely. That just looks painful.
Yeah.
Um,
Like going to get dental work without Novocaine.
right.
It's a terrifying experience.
Right. So, and then, her spouse is there, and he's like, she's just not, she's just in a lot of pain. And you can see it. He moved in because he wanted to be with her. And it's truly like something out of the Notebook. These two individuals are awesome. I love them. I'm happy to, go into that facility and see them, um, because you see the outcome. You see her out, walking the common area now, because she's not in as much pain as what she was, or any pain really. So it's really great. Uh, so at the end of the day, giving somebody that little bit of hope, like, listen, we got you. We're going to help you. It's comforting. It was really cool.
I love that story. And it highlights so many important things because, again, something you said earlier is, putting yourself in the shoes or, the body of some of our patients and just trying to, it helps you have some empathy
Mm-hmm.
for what they're going through. And there's no way we could truly understand unless you've gone through something like that yourself. But your commitment to getting to know these folks, where they're coming from, them as human beings, as individuals, not just a number, not just as a patient, but, oh, this is Mrs. Jones, right? She's got 3 kids, true notebook story with her husband. And here she is now, day one. There's fear, there's uncertainty, there's no hope. Man, I've been going to the wound clinic for 6 months, 7 months, and like I fear going there. I hate going there every single week. And I do it because my doctors tell me to, and that maybe eventually this is going to help heal my wound, but I haven't seen any evidence of that. And so this just weird juxtaposition of what's going on and what's going on in terms of from a mental capacity, a mental side of things, right? Where I'm like, well, what else can I do?
Right.
What else can I do? And then you come in and like, well, I've got something that might be able to help. And there's probably some hope, but there's also some, well, I don't know. Is it too good to be true? I'm just not
Mm-hmm.
sure.
Mm-hmm.
Did you experience that with her as well in the beginning?
I did. I experienced a little reluctancy from the husband. He's like, we've been dealing with this for so long. Like, I don't see an end in sight. And I said, listen, we have 10 weeks of treatment, with her. Our goal is to get that as healed as possible. Number one, so that your wife, you enjoy your times together and she's not in pain or being sent out to the wound clinic. So, like, your moments together are going to be a little bit more, you're going to have more time together. And he's like, man, I really hope so, Marty. It's just one of those things. And I don't mind that, he shortened my name by any means. It just gives me a glimpse into like how quickly we were able to kind of build that relationship with him. Um, but one of the really cool things as she was going through treatment, it was about, I want to say like week 4 or 5, like right before Memorial Day. I had gone into the building because I wanted to check in on other resident needs, and I caught her out in the common area. And she spotted me because, we come in, we have the black scrubs on.
Yeah, it's
She
hard to miss us.
recognized like, who I was. And I think initially she may have thought that I was the provider. So she spots me And I see her, and she comes up with her rolling walker. She run like, when I say run, but she bebops over to me, kind of clicks me in the hip with her hip, and she's like, "Hey." And I was like, "Wow, look at you. You're out. You're walking around." She's like, "I know. My leg's not in any more pain." So she then takes her arms, puts them around me, and goes, "Give this to Sean. I love you guys." And I was like, this is the moment why we do what we do, because it's the feel goods. You know, you just, at the end of the day, you feel good giving these people a means to an end. So, like, I picked up the phone and I called Sean. I was like, dude, we're doing amazing things for these people. And this is just one instance, one opportunity. We need more people to know about this. So it was a great visit, and just really an overall great experience with that family. You could see it. They breathed that sigh of relief, right, when they would see us.
And it's something that you said that was really important was it reaffirmed you already have and had massive belief in what we're doing, but until you actually witness the transformation, it's hard to really describe that feeling, that elevation in the belief behind what we're doing until you experience it. You see you see the patient story, and you're like, "Oh my goodness, I need to go out there and share this with everyone,"
Yeah.
because we both know how much of an issue and how much of a problem these chronic wounds are across the US. We're talking tens of millions of folks are suffering from chronic wounds every single day.
Hmm.
And the fact that we have the ability to go out there and not make a small impact, but a significant impact on that is just incredible. And so, as that, I mean, that's why we're doing this conversation, doing this podcast today. It's just another way to try and share with more people about what we do, how we're doing it, the results that we're getting, and share more of the stories. Because the more people can hear the stories, the more they're like, okay, maybe I should pay attention to this. Maybe I should give it a shot, even though I've done everything the doctors have been telling me, even though I've been dealing with this for 2 years, 3 years, and it hasn't gotten better. Maybe there's something that can actually help me.
I
And so
couldn't
that's why
agree
we
more.
do it.
I couldn't agree more with you, TJ. And that's one success story that we've seen. And if you're okay, if we have some time, I can share another wonderful success.
Absolutely. Yeah, that's why we're
Um,
here.
and this woman is just, there's just something, there's a mystique about her. She also was in a personal care facility, and when I had gone in and was talking to their director of wellness about things, she's like, "I have a resident right now that we're on the borderline of determining whether she has to go to a skilled facility. We were told this wound is something that she's been dealing with for 2 years. It was just like a small little decubitus ulcer right on the side of her ankle. I think, being that she was, in a wheelchair, she may have like nicked it, and over the course of time it just continued to get worse, never healing, continually just, going to the wound clinic. Um, and I think when I had come in and was talking to them about what we do, the director of wellness paused, and she goes, "I have a resident, but we were told this wound will never heal." And I looked her dead in the eye and I was like, "I'll take that opportunity. Give me
Yep.
your
That's one we
give me
want.
your give me your most chronic, gnarly, lost hope wound, because if I can make it 50, 60, 70% better, your resident can stay. You don't have to start looking for a skilled facility for her." So very early on in her treatment, we start troubleshooting things and we get things approved. Sean starts going in, builds a relationship with her, and her sight starts to get smaller and smaller after each visit. And after each visit, I go in about a couple days later, and I'm like, "Girls, have you seen what this looks like? And they're
I,
like, no.
I can't read this. Can you tell me what this says here?
They're like, no, we were told we can't take the wrap off. And I'm like, well, I appreciate that you're listening to our provider because we don't want you guys dealing with, the troubleshooting or having to rewrap anything. So, hey, when we tell you your hands off for a week, don't touch it. So thank you for listening. So then I start going in with pictures from the provider and I'm like, look at this wound. Look at this. Look how good this looks. And they're like, oh my gosh, look at all the new skin. So you can see like they're getting hyped because the patient's wound is starting to heal. It has gone from a stage 3 to a stage 2. And over the course of 9 weeks, we healed it. It was completely epithelialized.
Wound
It was,
that had no chance of healing.
yes, yes. So we were out celebrating her success. We took her some flowers. We took forget me nots and sunflowers. And again, being very observant, this woman loves flowers. So we got her a card. We said thank you. And when we came in with the flowers, first of all, she recognized Sean. She's like, "There's my guy. Did you bring my boyfriend with you today?" And I'm like, "No, but I brought this guy." She's like, I'm so glad. And she's 98 years old. She's with it. Um, very, very pretty lady. And she goes, I'm just so glad that I didn't have to fire you guys. And I'm like,
I'm
I'm
glad
really
you didn't
glad you did
fire us
not
either.
fire us too, because what we're doing, it it helps. It's giving you back your quality of life. And she's like, my leg doesn't hurt anymore. And hey, we want the success. We want you to feel engaged, and we want that level of hype from the other individuals who are a part of this person's care at the personal care site. So like when I start going in with pictures and outcomes and bringing value to my visits each and every time, you can hear the positivity coming out of them. Hey, we have another resident that we think you need to look at. That is the biggest compliment in what we do. They've already seen the value in what we bring. Now they want it for their next resident or that next person. So you get immediate buy-in, and it's just amazing to see in action, truly.
I love it. And, we could go trading success stories back and forth here all day. And again, it's why we do what we do. It's about the individual. It's about the family. It's not about, okay, we get to, throw some really cool graphs on, on wounds. It's about how is this making a difference, creating impact in the lives of the people that we serve. So I love that. And that's everyone at Rebirth that I talk to. It's the same mission. We're all pulling on the same string. So it's
Yeah,
really cool.
yeah.
But I know we're coming upon time, but I want to kind of leave with this. If you are, this question for you, Martin, we're addressing all of the healthcare providers out there, people in our referral network. Maybe you're a home health, in home health. Maybe you're in a skilled nursing facility, a hospital, and assisted living. You work with seniors in some capacity. Or maybe you or a family member is suffering from a chronic wound. What would you say to them as we're leaving this conversation, Martin?
There is hope. No matter how long you've gone through with that chronic wound, there is support, especially in Pennsylvania. We're very, very, I say, infantile in our history, but while we are small, we're doing some mighty things out there. And I think given the opportunity to help that person through that journey, we want you to have that level of hope. So it's there.
But the message is clear. There is hope, especially for those wounds that people have written off and said will never heal. Give us an opportunity, reach out. All of our information is here. No matter what state you're in,
Hmm.
reach out.
Yeah.
We want to be able to help.
Yeah.
So Martin, I really appreciate you taking the time. Really well said, and the stories I think are so impactful. We'll probably have to block off another time to just go back and forth and do this again because it was a lot of fun. I think
I
a lot of
love it. Of
value here for our folks. Again, thanks for joining.
course. Thanks, TJ.
All right.